Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about heavy metal testing. Someone recently sent me a question about what is my favorite heavy metals test, and that's a great question. I have posted about heavy metal testing and treatment in the past, but it's really a topic that never gets old, so I'm happy to post another video about it. So the answer to that, there's really, the question mark is, well, what are we wanting, what are we concerned might be an issue for the person? And what I mean by that is, are we worried about possible heavy metal poisoning / heavy metal toxicity, or are we worried about an accumulation of heavy metals in the person's body that may have built up over the course of time? It might be poisoning their mitochondria, depleting their antioxidants, things of that nature. So if we're worried about heavy metal poisoning, then to my understanding, the gold standard testing is to do a blood test for most heavy metals like lead, mercury, cadmium, things like that. Whereas if we're concerned, whereas for arsenic, to my understanding, a 24-hour urine collection is the gold standard test to look for arsenic poisoning. There is data looking at urinary levels of other heavy metals as well. Just random urine sample collection doesn't have to be a 24-hour urine, and so that can actually be enough information to tell about whether there's ongoing heavy metal exposure, at least. But that would be the best testing for heavy metal poisoning. The best test, on the other hand, for determining whether there's heavy metal retention in the tissues, like whether over the course of time there's been a buildup of heavy metals either in or around the cells of the body. To my understanding, the best test for that is to do what's called a provoked urine test for heavy metals. And what that involves is ultimately collecting two different urine samples. So there's the baseline urine sample, which is usually the first urine of the day. Presumably, the first urine of the day is your most toxic urine because overnight you're doing like housekeeping work in your body, so there's going to be more detoxification happening. And also, hopefully, you're sleeping a solid 8 hours through the night, so that's 8 hours of time for things to be building up in your bladder, which is why, of course, we typically have to urinate upon rising in the morning. There would be a baseline urine collection or a sample that's collected, and then the second urine sample occurs after a patient's been exposed to a heavy metal binding agent, also known as a chelating agent. And the way I describe it to my patients is that when that chelating agent is administered into the body, it gets into the bloodstream, gets into the cells and around the cells of the body, and it pulls it in, it binds to any heavy metals that are there. So it's kind of like we're going fishing for heavy metals in the tissue. And so when the chelators bind to the heavy metals, then that heavy metal chelator complex will ultimately go back into the bloodstream, get filtered by the kidneys, and then some of that metal will wind up in the urine. To my understanding, the majority of it actually winds up getting processed in the liver and then excreted through the bile system into the intestinal tract, and you actually wind up defecating out most of those metals that are pulled out. But as you might imagine, it's not very popular to do stool heavy metal testing, and there really, to my knowledge, aren't really any protocols to do sort of that baseline, post-chelation stool test. So we use the urine. It's much more user-friendly. And so once we have those results back, then we essentially have we have the two samples. So there's that first morning sample that tells us about the baseline amount of metal that's being excreted on an average day by that person. And then there's the post-chelation sample seeing, well, how much metal was pulled out by that chelating agent. So again, we're going fishing for the metals. So we're going to see how many of those metal fish did we pick up in that second urine sample. So both samples are sent off to the lab. We get the results back. It usually takes about a week to a week and a half to get those results back. And then we see the report, and it tells us how much metal is in each sample. And so for a lot of my patients, they're not, thankfully, not being exposed to high amounts of metals day to day. There are exceptions, of course, depending on their occupation, where they live, this and that. But by and large, most of those baseline metal samples are going to be quite low. There's going to be tiny amounts of lead, tiny amounts of mercury, tiny amounts of arsenic in that baseline sample. And the test panels that are done generally test for all of the heavy metals. It's not like, oh, let's test for mercury today, let's test for cadmium tomorrow, etc. We just get the whole test panel. So the second sample, if there was metal inside or around the cells of that person's body, then we'll see, oh, that tiny amount of lead in baseline, we see a much larger amount of lead post-chelation, or a much larger amount of mercury or cadmium, aluminum, whatever it happens to be. And in many samples, we'll see, oh, there's a small amount of say, nickel in the baseline urine, and there's just a tiny bit more post-chelation. So there was not an appreciable accumulation of a nickel in that person's body. Or we'll see that there's low mercury at baseline and low mercury post-chelation. We do pull more metals out in the post sample compared to the baseline in almost everybody, but that's why there's certain cutoff values where we, unfortunately, living on planet Earth, we've been exposed to a lot of toxic metals, and as such, there are going to be elevated metals in all of our tissues. However, it's just a question mark of, is it actually to a problematic level? And so there's certain cutoff points where if I saw that, oh, there's a little bit of lead at baseline, and then there's more post-chelation, but it's only, say, 2 or 3 or 4 times higher than that baseline amount. In my books, that's really not going to likely be significant. Whereas if there's 10 times more, 20 times more, 30 times more, it's like, wow, we went fishing for lead in this case, and we found tons and tons of lead in that person's tissues. There are different ways of using chelating agents to do the test, but I'm just keeping an eye on the clock and on the corner of my phone, and I see this video is becoming kind of long. So if anybody wants more information about the types of chelators that are used or the methods that are used, just post in the comment section below. I'm happy to talk about that. And I hope that this information was helpful for the person who asked the question.